Hi guys, my name is Krystal Haney. I am the Director of Training and Education here at Astanza Laser. I'm really excited to share with you guys a treatment that can be performed with the 8mm DF handpiece by Astanza Laser. This is an additional handpiece that can be added on to your Duality Signature or your Trinity. And so what we're going to be doing to demonstrate that today is we're going to be doing some scar revision. Now there's a multitude of capabilities that this new handpiece has in addition to scar revision. It can also do some skin resurfacing to help with fine lines and wrinkles. It can also be used in conjunction with your normal laser tattoo removal protocol. Now before we get started, let's discuss a little bit about the anatomy of the handpiece. So it looks very similar to all of our other handpieces, our OptiBeam 2 handpieces. The only difference here is that the spacer here is a little bit shorter because of the optics inside of the handpiece and what the focal point needs to be. So here you'll notice that it is identified of which spacer this needs to belong to or which handpiece this needs to belong to, so that way it can't get mixed up with all of your other handpieces. So here you'll see that it has the fractionated little appearance here instead of that solid square that you see on your OptiBeam 2 handpieces, and it is also identified by the handpiece size, which is 8mm. The other feature that this has is it does require a separate beam shaper than the ones that you use for your OptiBeam 2 handpieces on your Trinity and on your Duality Signature. So again, this is also identified by the fractionated little microbeam circle that you see here. And it is completely different, and what's really unique about this is when you have this beam shaper in the arm of the laser, it won't allow you to attach any other handpieces other than your fractionated handpieces. So before we get started, now we're going to make sure, because safety first, that we clean our patient. I've just got an alcohol swab here that's between 70 and 90% isopropyl alcohol concentration. I'm going to clean the entire area, making sure that I remove any excess debris and oils from the skin, as well as any superficial bacteria laying on the surface. All right, now I'm going to put my laser in ready mode. So I've already put all of my parameters onto the system. I'm also making sure that I'm wearing the right set of goggles since I'm working with a 1064 nanometer wavelength. Okay, we'll just wait for the laser to go into ready mode. I heard that beep, so I know that it's ready to roll. We're gonna do a little test shot here, okay? So we'll start up here. 1, 2, 3. All right. That was a little slight snap. I want to hear a slightly larger snap. So I'm going to go up by just probably about 0.2 joules per centimeter squared. And then I should probably be okay to continue the rest of the treatment and do about 3 passes with the DF handpiece. Increasing my fluence by 0.2 joules. Going back into ready mode. And I'm keeping this at a low rep rate because I don't want there to be too much overlap. So when I do this, I want to make sure that I'm spacing my shots right next to each other and not overlapping. All right, you ready?
Yes.
We go, 1, 2, and 3. Perfect. Just let him kind of calm down from that little shot I gave him. We're going to do the second pass. Okay. Are you ready?
Yes.
We're going to do this third pass. 1, 2, and 3. So that snapping sound I hear is perfect. It's the right amount of snap. Definitely not the same type of snap that you would hear with laser tattoo removal. You want it to be a little bit more muted than that. That looks great. So I'm going to put my laser in standby mode so that I can take off my goggles and assess my clinical endpoint. So if you take a look here, you can kind of see where the laser hit its mark, all those tiny little microbeams, little microchannels that have been created. And so what this is doing is it's actually creating tiny little cavities in the tissue that will kind of call to arms all of your macrophages and everything that's responsible for healing the tissue. And so when you do that, what that's going to do is it's going to help break up a lot of the excess tissue that's there, such as scar tissues. There's a lot of fibroblasts that just went into overactivity when this was healing. And so what we're trying to do is we're trying to break up a lot of that excess tissue with some of the macrophages that are responsible for breaking up some larger pieces of things that really we don't want there. And so it kind of activates them. They go in as an army, carry all of that excess tissue out, and then that gets carried out through your lymphatic system. And ultimately what you end up with after a couple of treatments is softer, smoother skin.